Hello, welcome to my channel. I'm Nancy. I'm an occupational therapist, and on this channel we talk about all things therapy. We talk about health and wellness. We talk about how to get into school, how to stay in school, and how to transition from being a student to a clinician. So welcome. Make sure that you subscribe, like, comment, and join the family. Make sure that you also follow me on Instagram. I post a lot on Instagram. And also send me an email if you want to collaborate. If you have any questions, DM me, okay? And yeah, I'm going to talk about how to increase quality of life in nursing home, because I feel like it's so important for us to not forget about our nursing homes, okay? And the first one that I want to talk about is to increase autonomy. We need to start allowing patients to engage in their self-care if they can. Most of the time, from what I have noticed, sometimes the GNAs, CNAs do a lot more for the patients that they need to, and they need to start allowing patients to do a little bit more from themselves, especially if they're safe enough to do it. The more you do it for a patient, the more learned dependency increases. So they learn to depend on you to do it for them. So allow them the autonomy to do a lot more for themselves. One thing that I have realized and I've come across is that we need to start to think about the fact that our patients have been they used to be in the workforce, right? I love to ask people what they did and their family kind of history and stuff like that, because I want to get a feel for who this person is and what they did, because in that way I can come up with different things for them to do. I have encouraged my patients to lead art classes and reading classes and things like that for the residents, because some of them actually used to be artists and teachers and chefs and so many different professions that we can actually use the talents that they used to do to kind of come up with different activities for other residents to do. I had a patient who used to be a chef and he loved to cook. I had him in one of my cooking groups. Incorporate what they already have. Some of them love to garden, so if you can start like a gardening club. We have so many talents in nursing homes that I feel like are going to waste because we are not utilizing them. Okay, so look into that. Be more intentional about that. Okay, the next one that I have on my list is to increase staff and patient ratio. This is such a huge problem, and it decreases the quality of life for a lot of our residents. If there's an increase in staff, then patients are going to be well taken care of, which is going to prevent a lot of things, a lot of comorbidities, a lot of secondary illness, a lot of different contractures, a lot of different things is going to decrease if we have a lot more staff available. I know people who will pee on themselves for hours and not get changed because maybe the staff, not that the staff has been negligent, sometimes they're just so busy because the ratio is just off. So we need to work better on increasing or making the ratio a lot better. Okay, next one on my list is activities. We need to increase activities in the nursing home and also out the nursing home. This really helps with quality of life tremendously if they have something to look forward to, something to do. I mean, imagine if you wake up every day and there's nothing to look forward to, nothing to do, nothing to get excited about. What's the point? I'm going to be like, you know what? I'd rather just stay in bed, because what's the point on getting up if there's nothing to do, if there's nothing to look forward to? So we need to do a better job in the nursing homes in coming up with different programs and different things in the nursing homes and also out of the nursing home for people to look forward to. And this will really help with their quality of life. Another thing is access to different things that they need. Access to phones, access to water when they're thirsty, access to different things, doctors, to just access to things that they need and want to be able to do is so important. This is another huge problem that I've come across so many times of patients complaining to me that they want to be able to call someone they can't call, they want to be able to do this, they can't do that. That kind of restriction is a no good. It's not good at all for a patient. So we need to do a better job in that. The next one on my list is relationships. Okay, I think that it helps them so much to developing good, meaningful relationships, even if it's a good friendship. okay, nothing sexual. It really helps increase motivation tremendously. Like, I've witnessed this, and literally my patient, when she started talking to this guy, she just perked right up. She was so excited. She was motivated to start doing therapy again. She wanted to walk again. She was so motivated. So let's not say to relationships, and why not, they're still patients, they're still people. We need to kind of see them as people instead of as patients, especially if they're cognitively intact and they can make good decisions, their judgment is there, the safety is there. Why not? Let's continue to encourage good, meaningful relationship among patients, okay? Even if it's a good relationship outside of the facility, this is really, really good. Wouldn't it be awesome if there was an app for that? Like Meet, I don't know, like an app for people in nursing homes, or an app for like older people to kind of meet each other, even if it's online. I really think we should look into that, because life does not stop because you live in a nursing home. It doesn't. And we need to stop making it seem like it's such a dreadful place and make it like a more lively place for our residents and our patients to enjoy, to want to be there, you know? Just the feeling of being able to form relationship, meaningful relationship, the feeling of being able to lead an art class and lead a gardening class and be engaged in these different things will really, really help, not just with their quality of life, but just in just their recovery process, and just feeling better, looking better, and wanting to do more therapy, and all of that is really going to be beneficial all the way around for that person. And I just hate when I see my patients just look like there's no life in them, and they're still here, they're still alive, they're still kicking. They should still be living life and doing the most that they can. Also, you know, stores, ShopRite, Wegmans, all those places need to start donating food to nursing homes, especially when we have to do like baking groups and things like that. Sometimes we need some donations. I've donated a lot of clothes to nursing homes, and I think people don't think about, like, if you are donating clothes to like Goodwill, nursing homes are another place that you can donate your clothes, your shoes, your coats, your socks, and things that you don't need anymore. Or even if you need them, if you feel like doing something back and giving back to the community, go to Walmart, get some nice shirts and some nice socks and stuff and donate it to nursing homes, because I have a lot of patients who don't have their own clothing and their own things to wear. So having something like that, like a clothing drive and food drives and things like that. Some of them also, I've had a lot of patients ask me, like, I really just want a soda. I just want a can of soda. Some of them don't have the money to get it. Some of them don't have the means to get in it. So donate things to nursing homes. If you're out there and watching this video, we really, really need it. And I think a lot of people don't think about it. I don't know the stipulations around this. I'll definitely ask my job, but I've worked in different facilities where people have donated clothes. I've donated my own clothes in nursing homes before, so it should be allowed. And we definitely need different sizes, different shapes, different things like that. So even if it's like decor, you know, people want to decorate their rooms and stuff, and not everybody have family members to do this for them, family members to bring them food or clothes. So if you're a restaurant out there, if you're a grocery store, you know, clothing store, don't forget about our senior citizens in the nursing homes, okay? We need to help them increase their quality of life. Some of them don't have anybody, and they're leaning on us as their last few years on this earth. Let's make it a great one for them. Make sure that you subscribe, follow me on Instagram, and I will talk to you in the next video. Bye bye.